Hi, good evening, everyone. You're on Facebook Live with Franklin County Commissioner Kevin Boyce, and I'm so excited for those of you who decided to tune in with us today to learn more about how Franklin County is serving the residents of Central Ohio. There's so much to talk about and so much to do, and so I want to dig right in, but I do want to set the stage. Franklin County is Ohio's largest county with over 1.3 billion people. We are growing and we're growing very fast. But that being said, we're seeing prosperity where before the pandemic started, we're seeing prosperity, we're seeing growth. But we also want to handle that in the right way. We don't want a tale of two counties where one part of our county is successful and thriving and the other part isn't. And so we're investing our time, our resources into you to ensure that Franklin County is better tomorrow than it is today. And that's why we convened today to share with you our work for our 60 and older population. So with that, we're going to dive right in. And let me again say, welcome, I'm Commissioner Kevin Boyce. We started these online forums to reach out to residents. We saw just how devastating the effects of the coronavirus and likely will continue to be. We've gone through the state's first coronavirus case being discovered on March 9th here in Ohio to more than 11,600 in 6 weeks. And our hearts and our prayers go out to those families that have been affected. We had more unemployment claims filed in 4 weeks during the outbreak than we have had claims in all of 2018 and 2019 combined. The outbreak of the coronavirus and its economic effects are hitting us all very hard. We've been working a lot on different programs to provide relief to all of our residents. However, these programs can't help if our residents don't know about it. And that's why we're here today. And today's discussion can undoubtedly help a lot of people. So even if you're listening or if you're not listening, we want you to share our information, share those resources, and help ensure that everyone knows and has access to what Franklin County has to offer. The Columbus Public Health Department recently took a deeper look at all the cases in Franklin County. And they found that our seniors, or folks ages 60 and older, make up more than a quarter of the cases in Franklin County. That's a lot when you consider the risk factors. Our elderly and population with underlying conditions are at greater risk. We're concerned about that. They also discovered that the biggest two groups affected by the outbreak were minorities, African Americans in particular, and our elderly. I took part in a town hall earlier this week on misconceptions and challenges for the African American community. And to be honest, there is much as we as society should do to discuss that, and more importantly, address those challenges. For today, I want to focus very specifically on our elderly residents. With me today, part of the discussion, I have the real experts. So let me introduce them. First, we have Franklin County Deputy Administrator Keena Smith with us. We have, and in case you don't understand the county structure, it's the county commissioners who sort of oversee all of Franklin County. And then under that are our administrators and deputy administrators. So Keena Smith is a very high-ranking person in our administration. Next, we have Amy Funk. Amy Funk is our acting director of the Office of Aging. And so she's here with us. Wave, Amy. Wave to everyone watching. And then we also have Damika Withers and Rebecca Becker, Rebecca Becker, who are both assistant directors of the Office of Aging. So welcome, everyone. I'm so glad that you've taken time out of your evening schedules to be with us so that we can ensure that Franklin County residents have access to information, resources, and most importantly, us. So let me begin with you, Director Funk. You're first up to bat. First, can you tell us a little bit about the Office of Aging and who you serve? Maybe give us a little bit about the demographics and kind of generally what the Office of Aging does.
Absolutely. First of all, Commissioner, I want to thank you for having us with you this evening and with the Franklin County residents today to be able to share the important work that's happening here at Franklin County Office on Aging. So thank you very much for allowing us this time. Franklin County Office on Aging is primarily responsible for planning and coordinating services and programs We assist older citizens in the maintenance of independent living. The Office on Aging administers two programs, Senior Options and Adult Protective Services. Our Senior Options program is funded through our Senior Services Levy, and it provides a one-stop shop for callers needing information, advocacy, or direct access to a variety of home-based, community-based services. Senior Options contracts with approximately 108 providers, and we provide Homemaker, personal care assistance, home-delivered meals, transportation, respite, emergency response systems, and minor home repairs. Our Adult Protective Services is funded by the Department of Job and Family Services, and it assists adults who may be at risk to be harmed by abuse, neglect, or exploitation. And some of the responsibilities that they provide, they do investigations, case planning, monitoring, and evaluation.
Outstanding. That's a lot, Amy. And I tell you, I know there are a lot of people who know about what we do, but they also see the Central Ohio Area Agency on Aging and maybe get the two of us confused at times. And so if you could maybe tell us what the differences are between the two. And let me give a shout out to Jamie Staley, who I know is watching us from Sister Cities. Thanks for joining us, Jamie Staley. Go ahead, Ms. Funk.
Thank you. The Central Ohio Area Agency on Aging, they started back in 1974. And they're operated actually under the City of Columbus Parks and Recreation. They're under the direction of the Ohio Department of Aging, and they manage services for people over the age of 60 in 8 different counties, including Franklin. They provide in-home services for the Medicaid-funded programs, including Passport My Care, Ohio Home Care Waiver, Specialized Recovery Services, and the Assisted Living Waiver Program. Franklin County Office on Aging provides services for Franklin County seniors residents only. Through our Senior Options program, we provide a variety of community-based services for Franklin County residents age 60 and over who have a demonstrated need. Senior Options provide services for clients who do not qualify for those Medicaid-funded programs due to their level of care needs or their income or assets. Without Senior Options, these residents would not have the in-home services they need. Franklin County Office on Aging partners with COAAA to provide in-home assessments and in-home case management for folks that require a greater level of care through our Senior Options program.
So Amy, that's great. I mean, so I know Orville Johns has joined us, so thank you. Good to see you. Orville, thanks for being with us today, one of our other county partners out there. Ms. Funk, though, to talk about, so the, you know, if someone were to call our number or call Central Area Aging a number, can they still sort of access us? Do we have a partnership with them where we'll send them to theirs if the resource that they need is from the other agency? Is there that kind of working relationship so they really can still just call one number and get directed in the right way, right?
Absolutely. They can call our Senior Options line at 614-525-6200, 614-525-6200 is our Senior Options line. And you'll get a case manager and a wealth of information and get connected to us or COAAA.
That's outstanding. Hey, Cortez, I see you joined us. Glad to have you, my friend. So Amy, you know, people, now let's talk about services. You know, people want to know when and during this time and even generally speaking, they want to be able to access whether it's our Meals on Wheels program or home repairs you talked about. And I know Becky's going to talk about that a little later, so you might save that for her. But if someone wants to access meals right now, what are the qualifications, even now during the pandemic? and B, what can they do? Who do they call? What number can they call if they want to sign up for Meals on Wheels or need some support that way?
Thank you so much for the question, Commissioner Boyce. I am really excited to highlight this new initiative for us at Franklin County Office on Aging and for the residents in Franklin County. On April 1st, with the help and support, of course, of the Board of Commissioners, Office on Aging launched a media campaign for a home-delivered meal project for older adults in the community. Our agency is offering home-delivered meals to any Franklin County resident 60 or over who is struggling to access food during the COVID-19 crisis. From now through June 1st, there will be no income or asset verification required for those meals, and therefore it waives those co-payments for clients during this time. We are asking that anyone requesting home delivered meals calls our senior options line at 614-525-6200. And that's Monday through Friday, 9 a.m. to 4:30 p.m. And a little bit more about that program. We have been posting some videos from some of our local community influencers on social media and some other media outlets supporting this campaign on our behalf. So please continue to be on the lookout for those and feel free to share them on your social media accounts to really help get the word out. We're hoping to continue to monitor this program to see what's happening through the crisis and potentially reassess the need for this at times throughout the remainder of the year.
That's great, Director Funk. And so again, for those who didn't get it, that number is 614-525-6200, 614-525-6200. You can sign up between now and when does the verifications go back to normal, Amy?
It's June 1st.
Through June 1st. So we want to encourage you to call. These are your resources. These aren't ours. These resources are designed to help families, to help folks in need, and we want you to access them. If you need them, call us and we'll help you out. 614-525-6200. I also see Joyce Patton joined us, and hello, Joyce, from Mary Ellen O'Shaughnessy's office. Glad to have you here. And I see Renee Starr is with us. So thanks for being here. Glad to have you. Let's keep it moving because we've got a lot to cover. And so I'm excited to talk to Damika. Damika is one of the assistant directors. And Damika, we know that you cover a lot of areas, but talk about the caregiver support and elaborate a little more on who's eligible, how they can receive caregiver support, and maybe what other resources they need to know. Also, if there's a number that they can call. Ms. Withers?
Absolutely. Absolutely, Commissioner. Thank you for being here and highlighting our programs at Franklin County Office on Aging. Our National Caregiver Support Program covers non-paid caregivers who are caring for adults ages 60 and older. Those non-paid caregivers can receive care for those adults that they are covering and caring for health maintenance supplies such as incontinence supplies, Ensure, get a 3-month supply of those services. We are also doing Homemaker personal care, in-home respite services for 60 hours. There is no income eligibility for this program. The caregiver must just be in care of an older adult who is 60 or older, and call the 614-525-6200. They do not have to be living with the older adult, but the older adult does have to be living in their home in order to receive these services. And right now we are taking those referrals for our caregiver program.
That's outstanding. That's helpful. And you heard the number again, 614-525-6200, 614-525-6200. My friend, State Senator Herschel Craig has joined us. Hey, Senator Craig, my favorite. And I know he's there watching with his wife, Linda Craig, who also works for the county. So thanks for joining us and having us on today. Damika, talk about our protection services. As we know, seniors can often be the target of maybe some bad actors and other challenges, and we are charged with protecting them. So maybe talk about protective services and how if someone suspects there's some concerns or has some suspicious activity going on, they can reach out to us and connect that resource as well.
Absolutely, Commissioner. Thank you. It is so important to keep an eye on our older adults at all times, and especially during this time, during COVID-19. Our case managers for our adult protective services are still home visiting and servicing, investigating allegations for abuse, neglect, and exploitation. If anyone out there is identifying or suspects that an older adult who is 60 or over is being abused, please call our number at 525-614-525-4348 to make a referral. If you want to remain anonymous in that referral, you are more than welcome to do so. Our intake line is open from 9 a.m. to 5 p.m. Monday through Friday. You can also call that number after hours and leave a message on our hotline phone, and also call that number on the weekend and leave that number, and someone is checking those messages and returning your phone call. You can also make a referral by fax by calling or faxing 614-525-5300 for fax referrals. Our online referrals are taking 24/7. You can access our online referrals at Franklin County Office on Aging.org by making professionals can make an online referral 24/7. It's very important, as we know that older adults are sometimes victims of exploitation, abuse, and neglect. And during this time, please check on your older adult neighbors, your older adult friends, ask them questions, visit them, keeping that distance with social distancing, wearing a mask, but it's having some eyes on the inside of what's happening. And our case managers are taking protective measures when they go and visit our older adults by wearing face masks. They are calling and asking the questions of older adults about what's happening in their home, making sure that they did not travel. And that is to protect the older adult and our case management staff as well. We are working with our law enforcement to do well check visits to keep an eye on our older adults. So we are still out here on the front line, making sure that we are protecting our older adults in Franklin County.
Yeah, that's just so crucial, the protection service. I'm going to come back to that in a second. I do want to say hi to the NetCare officials who are watching. Thanks for joining us today. Appreciate you. Also, Lorena Montez, I believe, joining us out there. So thanks so much for tuning in with us. We hope that the information we share with you today can be helpful and useful. And we hope that you share it to your friends, your neighbors, or whoever else may need it. Damika, I had a question that came in, and I want to punt it your way and see if you can maybe help one of our viewers here. The person asked about caregiver compensation. How does that work? If you want to be a caregiver for a loved one, there is a way to be compensated for that. Can you talk about that, or is that a good question for you or somebody else? But maybe just talk about the process and where someone would go to sign up, get more information, or just learn more about caregiver support.
Franklin County Office on Aging does not do caregiver compensation. However, we are able to provide you with support as a caregiver for the older adult that you are caring for. So when you call the 614-525-6200 number and you are looking for services as a caregiver for your older adult, you want to ask that person who answers the phone, hey, I want to sign up for caregiver services, and you will be transferred over to our friendly caregiver staff who will be able to walk you through the services that we are providing for caregiver. Again, those services are the incontinence supplies. When COVID-19 was not in place and adult day services were open, we were able to offer also adult day services. So when we get back to what we call our new normal, maybe hopefully that we will be able to do that as well as some in-home respite for our caregiving. Caregiving is a very honorable and sometimes tiring job, and we understand that here. So at Franklin County Office on Aging, when you call that number, they'll be able to kind of walk you through some of the services that we're able to provide through the caregiver services.
Yeah, that's an important thing to know, because many of us have loved ones and and we have to often take off of work. We have to sometimes, commit full time to that help and support. And so being able to access that information is helpful. And even though we don't do that part, we certainly will steer you in the right direction to help. And that's something that we're looking at from a government affairs standpoint for the county. We've been looking at ways to advocate outside of Franklin County with our legislature, with the federal government, to fight for some of these gaps in funds and resources that can really help families like caregiver support. So we appreciate that direction. Also want to give a shout out to Kevin Dixon from Adam H. has joined us. Hey, Kevin, glad to have you. And then also I saw Don Turnage is with us. And so thank you so much for joining us today. Excited to have you. And again, the main number to the Office of Aging is 614-525-6200. That's 614-525-6200. If we don't answer your questions today, or don't talk about your topics or subjects, give us a call. We'd love to hear from you. Okay, we'll keep it moving. Thanks, Ms. Withers. Stick around because there may be some questions coming your way, so don't leave us. Next, I'm going to direct this question to the Deputy Administrator, Keena Smith. As we've been going through the pandemic, the world is still moving. A lot of our issues and challenges are still happening. And as I opened up with, you can see Franklin County is growing, and we are growing and almost bursting at the seams. But embedded in that is the 10-year census process, that every 10 years, the federal government since 1790 has required everyone to take a census count of who is living in your community. And it's a number that is based on the residents in your community, And so we've got a lot going. The pandemic has taken a lot of attention from it, but it's still happening. And I can tell you right now, from a state of Ohio standpoint, we're competing with states like North Carolina and Georgia, where we could lose a seat in Congress after this census. And why that's important is because all the programs that we've talked about have some element or form of federal funding. There's a federal resource that flows to the Franklin County, and it allows us to invest our resources in people, in services, and the things that make your lives better and easier. So having that representation in Congress is a critical part of our success here in Franklin County. And so with that, I want to turn to Deputy Administrator Keena Smith and have you talk about what are we doing for the census, and more importantly, how are we ensuring that our elderly, our folks who are even 60 and older, what are we doing to ensure that they're being counted as part of our census process, even amongst this pandemic process that we've been dealing with over the last several weeks. Deputy Administrator Wilson or Smith.
Thank you so much for the question, Commissioner. And if I may take a moment to thank you for highlighting our older adults. In our community, they are truly our treasures. And I'm so proud to work for you and Commissioner O'Grady and Commissioner Brown, who are always supportive of our senior residents. And my thanks also to my team at the Franklin County Office on Aging. During this crisis, with the support of the commissioners and under the leadership of Interim Director Amy Funk, they haven't missed a beat. They are always compassionate, and that has continued. But even now, they're even more dedicated to our community seniors, and they've been amazingly innovative as well, which has made all the difference, I think, when it comes to keeping our seniors safe and keeping them at home as well. So I want to say thank you to Amy and Becky and Damika and the rest of the Franklin County Office on Aging team. Regarding the census, the pandemic has really dramatically shown us how very important it is that we make sure that every resident in Franklin County is counted. As you know, Commissioner, it is the source of our federal dollars for public services. And our public services right now under the pandemic are under a strain. And so it is super important that we focus in on making sure that everybody has the information that they need in order to take the census. What have we been doing in Franklin County? Well, one, we partner with our colleagues at the City of Columbus. And you, along with Mayor Ginther, are chairing the Complete Count Committee, of which we have about 30 subcommittees that are reaching out to our hard to count populations. And seniors are one of those populations. And I'm proud to say that Interim Director Amy Funk, along with her colleague Cindy Farson, are heading up that effort for us. And they've been active in the community, making sure that our partners are passing along the word, passing the word to our senior residents 60 and older. Now, of course, COVID has thrown us a curve. So we have not been able to be out in the community as we had planned. So in order to keep social distance, as well as follow the other safety protocols to stop the spread, we are now using our community. We use our community-based organizations, and they are, of course, using technology, but they are also writing letters. They are also making phone calls to reach out to our seniors during this time. We learned the other day that the census period may be extended to October 31st. It was originally scheduled to end July 31st, but the pandemic has caused the US Census to reconsider that position. And with congressional approval pending, we will be actually conducting census and taking self-response all the way until October 31st. So it's really quick and easy and safe and secure to take the census. And we're telling people that since you're already at home, why not take the census? Just put it on your to-do list. It's 10 questions. It takes about 10 minutes. You can go to my2020census.gov and take it online, but you can also take it by phone. So if you have a senior in your life that is not either comfortable with the technology, or if if anybody's mom out there is like mine, just kind of poo-pooing the whole computer thing, or just would rather not, you can get on a three-way with your senior and have them take the census by phone. And that number is 844-330-2020. That number is 844-330-2020. And like I said, it's just 10 questions. It'll take you about 10 minutes. You can help a senior, our older residents, by using that three-way on your mobile phone, giving them a call and helping them out. So that's what we're encouraging folks to do. Caregivers, daughters, sons, help your auntie or your uncle. And
that's right. Help Nana.
Yeah.
That's right.
People and
right, all of that,
all of that, and help them take the census in a new and unusual way, but it works, right? So
it does.
That's
Thank you so much, Deputy Administrator Smith. Let me repeat that. So it's www.mycensus2020.gov. That's mycensus2020.gov. And think about it. Billions of dollars come to Ohio every single year based on census data. So if you don't fill out that census form, if you don't call or go online and do it, then that's money lost to this community. And when you think about the impact of this pandemic on resources here, that money is critical. For all that we lost in the last census, now all that's gonna reconcile itself, and we'll see just how critical the census was. So again, that's mycensus2020.gov, or you can call 844-330-2020. That's 844-330-2020. And so I also want to give a shout out to Life Care Alliance that joined us here. So, hey, Life Care, Meals on Wheels is such a critical part of the services that you provide. And work with us as partners to do that to our 60 and older population. And then Francis Turners, thank you so much for joining us too. I see you online there with us. Also, Catherine Mosier. Hey, Catherine, good to hear from you. Haven't seen you in a long time. Hope you're well. But thanks for joining online for a minute today. And then Charles Gehrig. And then also Mohammed Jama. Thanks for joining us, Mohammed. I see you joined us too. Thank you so much. I know that you're doing a lot out there in the Somali community and all over Central Ohio. And so we appreciate you joining us online for a minute too. We're going to keep things moving. Again, let me give you those numbers to share with other people. 614-525-6200, 614-525-6200. That's our main line at the Office of Aging. And then also for the census, you can call and get registered at 844-330-2020. That's 844-330-2020. And you can do your part, your public service, your public duty, ensuring that you are counted. I think it comes out to something like $1,200 a person that doesn't sign up for the census. That's what it affects in money that flows to Central Ohio. Do you want your $1,200? I want mine. So I know I've done my census part, but we're asking you to do yours. So let's keep it moving. I know we've got a lot of people join us, so say hello to you in a minute. But let me keep going to let's see who's next on my little cheat sheet here. I think this is going to be for, let's see who have not gotten. Becky, I think you're up. I think we're gonna get to you. I think these are your questions. If not, you can punt them to somebody else. I'm okay with that. We're all very involved in the community, and the one question that we hear often is asking about what government business can be done. County offices have been closed to residents in many cases since late March. And sorry, I was getting a call there on my two-way. Since late March, in the Office of Aging, one of the offices that has been closed to the public. But if you could talk about the changes that we put in place operationally during the outbreak, and most importantly, how we're going to keep residents protected. Soon we'll be opening back up, hopefully, and folks will be entering our building, and we'll have employees and staff around. And so maybe talk about the office hours that we'll be keeping here, both now and when we reopen. Talk about any other elements of preparedness that we might have as we come out of the stay-at-home.
Okay, can you hear me, Commissioner?
Yep, can hear you just fine.
Okay, good. Thank you. I'm going to talk a little bit about one of the programs we have to help seniors stay in their home. The Office on Aging provides minor home repairs to Franklin County residents over the age of 60 with the goal of ensuring that their homes are safe and secure. Some of the services that we provide include minor plumbing, electrical, gas repairs, furnace repairs, hot water heater repairs. We will install handrails and grab bars in the bathroom, repair concrete that's at the main access to someone's home, their door or their steps. We provide wheelchair and walker ramps, smoke alarms, in addition to repairing broken window glass. Unfortunately, we do not assist with repair to roofs, foundations, or air conditioning. All of our work is done by qualified, licensed, and bonded contractors. During the COVID-19 stay-at-home order, our home repair department is only completing health and safety requests at this time, such as furnace repairs or hot water tanks, or when a senior does not have running water. To request assistance with minor home repairs, you must be over the age of 60, own and reside in the home, and be willing to share financial information. For example, a one-person household could earn up to $2,000 a month, a two-person household up to $4,000 a month to qualify for home repairs. To request assistance with minor home repairs, please call our intake line at 614-525-6200. Your call will be answered by one of our case managers who will gladly help you. Again, that number is 614-525-6200. And then I want to talk about another service we have, our senior option transportation services. The Office on Aging provides transportation services through our Senior Options program. We contract with 34 companies to provide this service. Some of the companies will provide on-demand service, while others will request a 24 to 48-hour to schedule a trip. Since the COVID-19 stay-at-home order, the volume of trips have drastically decreased for our providers, but they continue to diligently provide transportation to essential medical appointments and the grocery store. We provide 3 types of transportation: medical, expanded, and escort. And I'm going to tell you a little bit about each one. The medical transportation service, which is both lift and non-lift, includes transportation to medical appointments, medical facilities, or pharmacies. And there's no limit on the number of trips you can make in a month. Our expanded transportation service enables seniors to travel to various locations in Franklin County to assist in meeting their social and personal needs, like the post office, the bank, the grocery store, or to visit a friend. Expanded transportation is limited to 75 miles a month. Our last service is our Escort Transportation, and this service is designed to help a senior to travel to a necessary location, such as a medical appointment or the grocery store, with an assistance from an escort. The escort remains with the senior for the duration of the appointment or the errand. This service is limited to 6 hours per month. To enroll in transportation services, one must be over the age of 60, have need for the service, and be willing to share income information. For assistance with transportation, again, please call our intake line at 614-525-6200, and a case manager will gladly help you. Again, that number is 614-525-6200. Thank you.
Outstanding. And the transportation, let me zero in on that for a minute. First, let me say, I see Linda Keena with the National Coalition of 100 Black Women Central Ohio chapter has joined us. Thank you so much for being with us. And Diamond Lula, thank you so much for joining us today. Good to see you. So this transportation piece is a really important component. You know, I can remember when my grandmother was accessing services and she couldn't drive anymore. And so then it became such a, you know, burden is not the right word, but sometimes getting family members to get her to the doctor, get her to the grocery store, get her to, pick up meds at the pharmacy could really become a very difficult situation for families. So the transportation piece is just critical. Are there any costs to it to the residents? And B, will they go anywhere or just to certain places? Is it a situation where they pick up a group of people and then take them, to the store or whatever, or is it they just schedule it, they get the one-on-one, or they can just catch a cab or catch one of our transportation services? I'm not that familiar with it, but I know when my grandmother used it, it was a godsend and a very much a lifesaver for us because it allowed her to still get the things she needed when folks in the family couldn't do it that day.
Right. As for the cost, that's why we ask for residents to be willing to share financial information. For many of our seniors, there is no cost. For persons with more income and more assets, we utilize a sliding scale fee, so they might contribute something toward that. As for trips, they can travel anywhere in Franklin County, pretty much wherever they want to go, and it's an individual trip, so they go by themselves, or sometimes they'll go with a companion to help them. As for group transportation, we do meet that need through some of our grant programs that help with groups out in the community to transport them to grocery stores and places like that.
That's outstanding, and it's such an important thing for folks to understand. Again, that number is 614-525-6200, 614-525-6200. I see Carolina Trinidad has joined us. I think she's one of our county folks. Good to see you, Carolina. Let's keep this conversation going. Let me open it up a little bit. I'm going to go back to Director Funk, if you will. Director Funk, talk a little bit about the number of people generally that the Office of Aging serves in any given year, and talk about what is your budget? How much do we spend? How much do we allocate towards, and Becky, this may be you, whoever can answer this question. How much do we spend a year on these services, and how many people do we serve in any given year?
Thank you, Commissioner, for that question. We serve approximately 9,500 older adults each year. And the actual cost that goes towards these services specifically for senior options is about $24 million. So it's a big budget item. We are really busy here at Franklin County Office on Aging between the senior options and our adult protective services. As I mentioned before, we have generous funding through Department of Job and Family Services for our adult protective services needs and requirements.
Yeah, it's such an important way to talk about that, because as I think about Director Funk, as I think about Franklin County and how we carry out services, I think of it in terms of those who are most vulnerable amongst us. And so I would start with our seniors or 60 and older population, and then certainly our young people, that, you know, minorities. We want to focus on folks who may not have access to certain resources or may be vulnerable in other areas. And so I just want to say, I think your team does a great job. It's a huge resource. And again, we want to encourage anybody listening to, whether you post it on your Facebook site, your Instagram site, or whatever, put our number out there. Let us hear from you. We want to know what we can do to help make your life better tomorrow than it is today. We know we're not perfect, but we want to be. We want to serve you in every way. And so I want you to call us at 614-525-6200. And Director Funk, what's the website? If folks want to get online and kind of scroll through whatever we've got posted, what's the website they can go to?
Absolutely. Thank you. Our website is a wealth of information. It is officeonaging.org.
And Commissioner, I think you're muted.
Yep, I was muted. Thank you so much. But now, since you got on there and unmuted me, I'm gonna ask you a question. You know, so you just did it to yourself.
Well, I just wanted to make a comment really quickly, if I may.
Oh, please, go ahead.
I just thought it was important to mention that the Office on Aging is a levy agency, which means that it is direct public dollars of voted levy. It comes up again, I believe, in 2022. Is that correct, Amy?
Yes, that's correct.
And so, you know, the importance of the levy is, you know, it keeps us accountable to our public. And we want to make sure that we are serving our senior residents as well as we can. So we want to invite everybody to give us that feedback.
Absolutely, and I'm so glad that you shared that with everyone. You know, we are doing our best to be the best county that we can to make sure that the residents know that they can live, work, and raise a family in the best place in America. That's really what we seek to do. Our motto is every resident live by that, and we try to live up to that. So hearing from you is a critical part of us doing our jobs. And so we want to encourage you to call us with the good, the bad, and all the in between, and let us know how we're doing. That being said, let me close out some of the conversation talking about the COVID-19 pandemic that we've all been touched by one way or another. For the last month and a half, we've been shut in our homes. Our schools have been closed. Businesses have been shuttered. And many of us are wondering about the next phase of life. Know this, Franklin County, we meet and work every day to try to figure out that pathway so that our families can be the best that they can be. And every day since the pandemic has started, we meet at 9 a.m. and it's a public meeting, so you can join us on our conference call. We meet every day to discuss not just our response to COVID-19, but what things are going to look like when we come out of this pandemic. Right now, we're talking about things from a public health standpoint, and it's so good to see the conversation around the value of public health at the forefront, albeit under bad circumstances. But the good out of this is that we'll be stronger tomorrow than we were today because of it. And our public health professionals and those who are healthcare workers on the front line will be better and more prepared to give them the resources they need to protect us in these kind of environments. That being said, there's layers to this. There are so many parts that we as county commissioners have to think about that will go into the next several months trying to figure out. So we've done some things to try to get at the short term. For example, since this has started, we've provided more than $10 million to our residents, for our residents, to help during the outbreak. We provided emergency grants for our most economically challenged families. We provided funding so that the convention center can be an overflow hospital facility when the hospitals, or if the hospitals, fill up. We've had so many people listening and sharing other details throughout this time. We've been able to act quickly on some things. And so we quickly dispatched $500,000 to ECDI, the Economic Community and Development Institute, that leveraged over $2 million for small businesses and small business loans to keep those doors open and prepare for the shutdown. Over $500,000 in workforce to our Workforce Development Board to help folks with training and access to job searches as we come out of this pandemic emergency. And grants to organizations like the Columbus Urban League, the United Way, Impact Central Ohio, and so many more that are working with us as partners to do the best we can to provide for a pathway so everyone can be safe, can be healthy, and that we can thrive together, because that's really what this is about. The conversation today was about seniors, but tomorrow it can be about young people. It can be about housing and access to affordable housing, or it can be about jobs and economic development. These are things that it's going to take for all of us to be able to work together. We got to hear from you so that we can make Franklin County, again, the best place in America to live, work, and raise a family. We're not done. We've got about 10 minutes that we're going to go. And so I'm just going to circle around to each of my guests for today and ask them if you've got any sort of parting words, any parting comments, and don't say no. Don't say no. You got to have something to say. Share with the residents, just something about the agency or about this time, something positive. You can say anything you want, but when I give you at least 60 seconds to just make a comment. I'll start with you, Director Funk.
Thank you, Commissioner. I appreciate that. I did want to recognize the hardworking staff here at Office on Aging. They are putting in, they are teleworking during the pandemic. We do have some folks in the office during this time to handle the phones, but for the most part, the majority of our staff are teleworking so we can properly be social distanced. But I did want to highlight what great work they're all doing, working long hours and ensuring that our older adults are getting the critical services that they need during this time. And one example I wanted to point out was that our senior options, since the beginning of April, has answered 3,474 calls. So that's a lot of calls. There are about 231 calls a day. So we've had, some statistics around that. I mean, we've, had provided 518 older adults with home delivered meals since this campaign of our home delivered meals started. So again, I just wanted to highlight the great work that's going on over here at our agency. And again, I wanted to also thank the Board of Commissioners for all that you do for us every day and the support that you provide, as well as a big thank you to County Administration as well.
Thank you so much, Director. I'm going to go to your assistant directors. Damika, Becky, do you have any parting words before I close this out? I'm going to turn to you, Deputy Administrator Smith. So, Damika, Becky, you got any parting words?
Absolutely, Commissioner. Thank you, Commissioner Boyce, for being here. And just continue thanking you at Commissioner and our county administration for the support. And I just want to thank our partners out there willing to older adults. And again, our staff, just as much as Amy just said, thank you to our staff. Again, our home visits, they are still connecting our seniors to medical professionals, any mental health care that they need, any law enforcement well-check visits, again, that they need. So I encourage the community to please watch over your older adults, make sure that you see any signs of abuse, neglect, or exploitation, and call our Adult Protective Services staff. They are doing and working on the front lines to continue to care for our 60 and older adults and offer those protective services. So again, I thank the staff. I thank all the Franklin County community for continuing to watch over our older adults and having just a different creative way to have an inside view in the midst of the coronavirus. So thank you all for being here and supporting Franklin County.
Thank you so much, Becky. I also want to give a shout out to Jenny Snap with EDP, and I see Leader Sykes from the House Representative has joined us. Thank you so much for your advocacy in the House Representatives. Becky?
Okay, I just want to say that Senior Options is here to help anyone over the age of 60. If we only talked about a couple of services today, but we have many more. And when you call us, if it's not a service or even if it's just for information, if we can't get the answer, we can refer you to where you will get the answer. So please call us, ask for help. Our number again is 614-525-6200. And then I want to thank you for allowing us to be here today to talk about our program.
Great, thank you so much. Now, Deputy Administrator Smith, closing comments. Are you there, Deputy Administrator? Okay, we'll keep moving. Let me close this out. Oh, there you are. Go ahead. Now, we can hear you now.
I just wanted to take a quick moment to say thank you to the residents of Franklin County for entrusting us to help you take care of your loved ones. And of course, thank you to the county commissioners and to the staff over at the Office on Aging. And remember, stay home, wash your hands, keep social distance, and remember to cover your face when you're in public, and don't forget to take your census. Thank you, Commissioner.
Thank you, Deputy Administrator Smith. I also want to just recognize our interpreter today. Thank you, Jamie, for being with us today. We appreciate it. And I know I speak on behalf of the Franklin County residents that appreciate it as well. So thank you so much. I'm so grateful. I want to recognize Jody Andes in our Department of Public Relations. This has been a very good, I think, way for us to share information with folks who need it the most. And just remember, we're here for you. We work for you. And it's we believe that every resident every day is a part of our mission. Now, let me close by saying this. We'll be posting this video on our YouTube channel so that if you know people who could benefit from this information that weren't able to be here today, you can send them right to our YouTube channel. And the address is way too long and too cumbersome for me to read. You won't get it. So we'll post it. We'll find a way to post the link maybe now in the comments area now, which will be helpful. And you can copy that. You can also find the link to it and more information at our website. That's at commissioners.franklincountyohio.gov. That's commissioners.franklincountyohio, spelled out, .gov. We also utilize Facebook, Twitter, Instagram, and Nextdoor. If you use any of these outlets, stay in touch with the world. Please connect with us there. We use the platforms on a daily basis to provide information to residents, and most importantly, in a way that we hope that you can share so that people, everyday residents, can access the information when they need it. Until next time, I'm Franklin County Commissioner Kevin L. Boyce, along with Deputy Administrator Keena Smith, Office of Aging's Director Amy Funk, and my staff, Jessica and Tamara. Thank you so much for what you do and being part of this team. And we hope that this information was useful, and we hope that we'll see you soon. Thank you so much for joining us. Stay safe. God bless you.